Welcome to the official launching event of the Hispanic and Latino Behavioral Health Center of Excellency, Advancing Behavioral Health Equity for Hispanic Latina Communities. We truly appreciate you taking the time to join us, and we are very excited about sharing our work with you. To hear today's presentation in Spanish, please go to the Interpretation tab on your Zoom panel and click Spanish. You can also mute the English speaker's voice by clicking mute to the original audio. During today's webinar, the events are being recorded. All participants will be muted and cameras turned off. Please make sure your computer speakers are turned on and up to hear today's presentation. If you are having any technical issues, please send a message to Hispanic and Latina Behavioral Health Center of Excellency on the chat box. If you have any questions for our presenters, we ask you to use the Q&A tab on your toolbar. Type the questions and hit send. We can address questions to the presenters at any appropriate time during today's presentation or at the conclusion of today's presentation. Evaluations will be completed. You have to complete the link for the evaluation we shared through the chat. You can also scan the QR code at the end of the presentation to complete it. The Hispanic and Latino Behavioral Health Center of Excellency recognizes the complexity associated with gender and ethnic identification, as well as the right for all individuals to self-identify. The center uses the term Latina with the intention of both facilitating a fluent reading and pronunciation and supporting any inclusive and respectful language. Latina is a gender-neutral form of the word Latino that uses the letter E at the end, an idea native to the Spanish language. And now I would like to introduce Dr. Lark Wong from the Office of Behavioral Health Equity, who is joining us today. Dr. Wong is the Senior Advisor in the Office of the Assistant Secretary of Mental Health and Substance Use and Director of the Office of Behavioral Health Equity. She is a licensed clinical psychologist who has worked at the interface of policy, research, and practice in behavioral health for nearly 35 years. As the Director of the OBHE, Dr. Wong provides leadership to advance equity and eliminate disparities in behavioral health for underserved minority communities and to ensure an equity agenda in SAMHSA programs and policies. She implements innovative efforts to advance health equity basis on metrics of access, quality, and outcomes of care for underserved diverse populations, elevating on a focus on strengthening community-level efforts and consideration for social determinants of health. I leave with you, Dr. Hong.
Thank you very much, Carmen, and I'm pleased to be here today and to welcome and congratulate Dr. Ibis Carrion and her team on the launch of the Hispanic Latino Health Center of Excellence. Ibis has been a longtime provider of training and TA, technical assistance with SAMHSA, and we're pleased that she'll be leading this Center of Excellence with a host of partner organizations and universities, and all towards the goal of improving and increasing culturally informed mental health promotion and substance use prevention, treatment, and recovery services. And you'll be hearing more about that and some of the work to come from the center today. Ibis and I will actually be meeting at SAMHSA tomorrow. Also, I believe she's going to travel after this event to SAMHSA for a meeting on building the behavioral health workforce to better meet the needs of underserved communities across the country. We've always had a shortage of behavioral health providers and practitioners. This was then exacerbated by COVID-19, where we saw a tremendous exodus of providers from the field, such that we have now reached crisis proportions in terms of shortages and uneven distribution of the current workforce. And this crisis is particularly exacerbated and particularly affects the access to care in our underserved communities. So among its many tasks, this Center of Excellence will also be addressing how to engage members of the community and increase the numbers of Latino, Hispanic serving behavioral health practitioners. We will also be examining at our meeting tomorrow and with this Center of Excellence, how we can augment the workforce with other community-based care providers, whether they are peer specialists, community health workers, faith-based leaders, or other naturally existing caregivers that we're also trying to identify funding for and reimbursement for in our public and private payer systems. So there's a lot of work to be done in terms of really addressing workforce issues, which have a big impact on access to care, particularly again in our underserved populations. At SAMHSA, we are also in the process of developing our language access plan, and we'll certainly seek input from this center and its team of experienced trainers and interpreters. So there's a lot of work we expect coming out of this center, a lot of ways we look to bring our various training and TA centers to partner among each other as well, and to partner with us in our Office of Behavioral Health Equity at SAMHSA. We think the inequities and disparities across populations continue to persist. We also think in this particular administration, we've had more opportunities than usual in terms of really trying to advance our efforts to reduce some of these inequities. So again, we congratulate the center. It's launched today, and we really look forward to its leadership in the field, its partnership with many of you that are on this webinar today, and the exciting opportunities it will be providing for learning and training. So thanks for giving me a few minutes to welcome and congratulate you, and I will turn it back to Carmen now. Thank you.
Thank you. Thank you so much, Dr. Wong, for taking time from your busy agenda to join us this afternoon. Now I would like to introduce our center's director, Dr. Ibis Carrion, which will share with us a few words about the work that we will be doing moving forward with the Center of Excellency. With you, Dr. Ibis Carrion.
Hi, it's a pleasure to me be here today. Welcome to our center, Hispanic and Latino Behavioral Health Center of Excellence. It's important to talk about the reason to have a Center of Excellence working with the Hispanic and Latino communities, because our population is the minority more big. We are 2022, 63 million. And for 2060, we will be 111 million. This is a huge population. And why a center? Because our population is growing. We have, as Dr. Wang talked about the workforce, we have significant shortage with the workforce in the areas of behavioral health that are very important for our communities. Also, the needs of culturally competent and informed information that responsive the needs of our communities. And another thing that is very important is that we have less, we are less likely to receive a treatment routinarily, and is as part of our difficult with the language and other barriers like language, as I said, cultural differences, stigma, and poor literacy, mental health issues, the situations with our immigration status, and the experience that we had during the immigration process. Also, we are one of the minorities that less or lack health insurance, and poverty. Saying this, it's important to talk about our purpose. The purpose of our center is to advance the behavioral health equity for the Hispanic and Latina communities. How? We will be developing and disseminating culturally informed evidence-based behavioral health information. We will be providing training and technical assistance on evidence-based and best practices for our community. In occasion, the evidence-based practices not necessarily represent our community, and we need to develop an adaptation for our community. And these are essential parts to see when we will be working with us. In addition, it's important to talk about that best practices in mental health promotion, prevention, and treatment, and recovery from mental health and substance use disorder. Another goal for this new project is expanding the behavioral health workforce for our community. We are very excited because this is an area that we will be working for first time, and we developed some innovative initiative to address that area for our communities. Now I will share with Dr. Dari Sorovich.
Hi, everybody. I am Dari Sorovich. I am a training and technical assistance consultant for the Hispanic Latino Behavioral Health Center of Excellence. I will briefly speak about our mission and as well as our areas of focus and the structure of our center. So our mission is to advance and support the sustainability of behavioral health equity by promoting community-driven, culturally grounded, and person-centered prevention, intervention, multiple pathways of recovery, and recovery supports for diverse Latina communities. So our center is dedicated to promoting equity in behavioral health for Latina populations by developing, as Dr. Carrion said, by developing and disseminating culturally informed evidence-based behavioral health information, providing training and technical assistance on evidence-based practices in behavioral health, including promotion, prevention, treatment, and recovery from mental health and substance use disorders. We plan on expanding the workforce that serves Latina communities, and we serve as a resource for mental health, substance use, peer support, primary care providers, stakeholders, community-based organizations, entities, clinicians, students, and all those involved in the well-being of our Latina communities. So as you see, our focus areas include the sharing of information, training and technical assistance, as well as expansion on the workforce. These are the components of our center and the main goals that we will be working with. So now I'll leave you with Yvette, who is going to share some information on outreach and engagement.
Hi, everybody. I want to start off by saying thank you for being here. It's so important for us and the launch of this center that you guys took the time to sit here with us and listen to a little bit about what we're doing. As outreach and engagement, really a part of what the team is going to be doing is playing that key part in ensuring that our goals and that our that things that we want to make sure get done do actually get done, right? So we want to meet that through effective outreach. We want to make sure that you guys understand and that you guys know what we have to offer, that you guys are always up to speed and up to date on those educational pieces on how to collaborate together, how to make our centers work together, how to work it to a better point. What we really want to do is make sure that we enhance that project visibility, that you guys are always aware of the work that we're doing, that we can engage you and impact your communities positively. Part of what we're going to be doing is developing some of those outreach strategies. So a lot of you can decide to reach out to me or reach out to anybody in the team and talk about what your community needs, because we do want to do targeted campaigns. We want to make sure that we are reaching your community in a way that's positive and impactful for you. Every community is different, and we understand that. We want to reach new audiences. We want to make sure that the audiences and the people that have been engaged with all the services and the work that's being for the Hispanic and Latina communities are connected to our project. We want to continue to expand, and we want to continue to reach our arms out and make sure that everybody is receiving this information. We are going to be doing things that are very evidence-based, right? All our work is really evidence-based. Our trainings are evidence-based trainings. And part of what we're going to do is really conduct statewide science-based behavioral health outreach. So we're going to be looking for best practices on how to engage Hispanic and Latina communities and how to best help you engage Hispanic and Latina communities and keep them engaged in what your services are and the work that you're doing. We're going to be working on creating working opportunities. We are definitely, there's in the works, and there will be at some point conference for the Center of Excellence so that you guys can come together, so that we can actually meet face to face, and you guys have the opportunity to tell us what you guys feel you need throughout that process. And definitely part of what I'm going to be doing is trying to make sure that with our different social media, with what it is, our newsletter, which is going to be coming up. We're going to be talking a little bit about what our website is going to look like. One of our people is going to be talking to you about just the social media and how we're going to be using that to make sure that you guys always know what is happening with the center, the resources that we're developing, the functions that we can do, how we can come into your community and really offer you what it is that you feel you're needing. So I just want to encourage everyone to feel free to always reach out to me or anybody in this organization and anybody in the Center of Excellence and let us know what it is that you need, because we want to go out and give it to you. We want to make sure that we are meeting your community's needs as we walk this path together to building health equity for the Hispanic and Latino population. So thank you. I talk really fast, so please feel free to reach out and with any questions. I'll always be here to make sure that we are supporting you and walking this road with you guys. So thank you. I think this goes back to Mr. Eric and Darius. So let's go ahead and talk a little bit about the things that we can offer and some of those things that we're working on. Thank you guys for being here again.
Hi, everyone. My name is Eric Senior. I am the Training and Technical Assistant Manager for our Center of Excellence. And I'm really grateful and happy to be joining you all today and to talk a bit more about our center and how we're looking to help expand services, capacity building, and this central focus area of ours, dissemination of culturally informed and evidence-based behavioral health information. So we're looking to have, right, an inventory of resources which can be available on demand for behavioral health providers that work with Hispanic and Latina individuals, families, and communities. And we'll do this in a number of formats and ways. If you can go back to the previous slide, thank you. We'll do that through webinars, fact sheets. We'll also have manuals, which can be on-demand manuals and curriculums, which help expand culturally informed practices and best practices, which we know serve the unique needs of the Hispanic and Latina communities, not only in behavioral health, but also in peer recovery practice, substance use treatments, as I saw in the chat, and we'll get to that as well. If you can go to the previous slide, please. Thank you. Also working on areas that are really important with community engagement and promotoras and community health workers. So our products are developed for all these type of providers within the workforce, and training and technical assistance for Hispanic and Latina communities, right? So we'll have training events, both virtual as in this format and in person, on evidence-based practices, which are cultural and linguistic considerations relevant to behavioral health service and substance use prevention, treatment, and recovery. Much of what we do is knowledge transfer, skills acquisition, capacity building. So we're here to serve you as best as we can with those needs you may have at the national level. And you can request these trainings and technical assistance at no monetary cost to you or your agency. And we can give include also intensive ongoing consultation on those specific issues relating to behavioral health with the Hispanic Latino communities you may be serving. Um, and now I will hand it off to Dennis Vasquez, our workforce manager. Thank you.
Hello, everyone. My name is Denis Vasquez. I am the Workforce Manager at the Center of Excellence. I am very excited to share with you some of what we are going to be doing in the workforce area for the center and for our community. So I'm going to start sharing the goals of our area. We really want to develop, grow, and nourish the recruitment of new leadership roles and career pathways in the behavioral health field for Hispanic Latina professionals. And for that, we are going to have an initiative that I'm going to be sharing with you shortly, create evidence-supported innovative recruitment and retention strategies, connect and partner with universities in order to increase the number of behavioral health professionals that are out there giving services to our community. Also, we want to support and design the production of new behavioral health public policy in order to give access and culturally appropriate behavioral health practices and services for our community. And we have these goals because obviously, as Dr. Wang was sharing, we have a shortage in behavioral health professionals. And in the next slide, we have some of those stats. Behavioral health professionals that identify as Hispanic, we have some numbers here: 10.7% of counselors, 12% of social workers, 6% of psychologists. And obviously, as Dr. Carrion was sharing with us, the Latino and Hispanic population is really growing in the United States, and we want to attend to that population mental health needs, and for that we need to grow the workforce. So I'm going to share with you 3 projects that we are developing on our workforce department. We are very excited about them. The first project is the Vamos por Más Leadership Empowerment Academy that will provide Hispanic and Latina entry-level behavioral health providers the opportunity to strengthen their decision-making skills and facilitate their professional growth to become candidates for leadership positions. We want to have leaders that are Latino, Latina, and that look like us, right? And that look like our community, giving service to our community. And in order to enhance that, we are creating this leadership academy. Also, we have the policy academy. We know the importance of creating new policy for the Latina community in the areas of behavioral health. So we will be developing partnership between counties and states officers to enable the implementation of public policy practices in the behavioral health field for Hispanic and Latina communities. And lastly, I'm going to talk to you about the Student Workforce Initiative, which will select students from the 10 states with the highest emerging populations of Hispanic and Latino students in order to advance their skills and linguistically and culturally appropriate services for our communities to have a workforce that responds to them and their needs. That will be all for the Workforce Initiative. I'm very excited to see your questions and commentaries. I'm very open to all of them. Thank you. I'm gonna share the screen with Christine now.
Hello, everyone. My name is Christine Miranda. I am the center's evaluator. I am in charge of all the evaluation and the environmental scan and also the language access inventory. I want to share that we will be conducting an annual environmental scan survey through surveys and in-person or virtual listening sections to inform the development of culturally informed behavioral health information pertinent to the Hispanic and Latino communities. The survey will include questions about demographic data, type of organization service provided, percentage of the Hispanic and Latino population served, number of behavioral health specialists and number of bilingual behavioral health specialists, primary service needs of the Hispanic and Latino population they serve, critical barriers in the provision of behavioral health services, and needed training and technical assistance by staff, type of training, and the number of staff to be trained. The language access inventory will be constructed to inform and obtain information of the community service available to the Hispanic and Latino around the US. The survey will include questions about demographic data, number and type of behavioral health specialists, number of bilingual behavioral health specialists, behavioral health conditions of areas or needs served, language services are provided, interpretation services, telehealth, crisis intervention, or emergency services, among other services, provision of culturally and linguistically care. We plan to launch this inventory for January 2025.
Hi, thank you, Dr. Miranda. So as part, as you know, very important for us, communication engagement strategies, and we do this through training activities and service offered by our center and conduct outreach to the diverse audience who are potential service recipients of the center through the use of tailored follow-up emails, email blasts, through constant contact, newsletters, and social media. And there you'll see our hashtag. And so we have our digital presence through Facebook, Instagram, and LinkedIn. You can use these QR codes to find us and follow us. There you'll see we promote as much as we can of our events, our activities. We have actually 2 events coming up this month, so you can see them promoted through these social media platforms, and we really would like for you to follow us and really engage with us and address any questions you have for us as well. And now, if I could actually share the screen, we'll just take a second so we can show you our website as well. And what you see when you open our website is that all the focus areas that we've spoken about, all the divisions we've spoken about, workforce development, training and technical assistance, dissemination of behavioral health information and culturally informed practices, and also how to request training and technical assistance can be done through our website. And as I mentioned, you'll be able to see many of our our offerings and events. Oh, here we go. Okay, great. So here we have our official website, and as you see here, you see some information about our team that we've been speaking today, our steering committee, which is composed of 12 members from diverse backgrounds from the Hispanic and Latina community, our partners, our contact information, and our focus areas, as we mentioned. Our upcoming events are here in the events section. And you'll also be able to find some of our resources. As I mentioned, we'll have inventory of products will be helpful for providers working with Hispanic and Latino communities. And as we mentioned, we have a very important focus on language access, and you'll be able to navigate and search our language access here. As you'll see, here are focus areas, so you can see a bit more about them. And when you are interested in reaching out to us, if you have any training or assistance needs, you can do that through our request TA section. So we'll hopefully be sharing those this website with you as soon as possible. If not, here is the The address, HispanicLatinoBehavioralHealth.org, HispanicLatinoBehavioralHealth.org. So I'll hand it off again to Charlotte if you want to bring back our presentation. Thank you. I think at this point it's time for questions, and I know that many questions have been started to coming through the Q&A. So thank you for addressing that. I'll just address the first question, maybe as any of other members from our center can start looking at them. But I know there was a very important question at the beginning in terms of how we are engaging and Sam's engaging with promotoras and community health providers, and that's a crucial part of the work we do as well. As part of our steering committee, one of our steering committee members, Thelma Garcia from the East LA Women's Center, who has vast experience working with promotoras and not only in mental health, but also HIV prevention. So as we consult and receive guidance and expertise from promotoras, we learn more about the types of culture grounded and community driven practices that they do, and how they are also an essential part of the workforce and workforce expansion strategies.
What is it gonna? Eric, if I may add to that, the questioning also includes traditional healers as part of prevention and intervention, psychoeducational interventions. So historically, we've included traditional healers and the philosophy behind those traditional healing practices as an important element to consider and incorporate in behavioral health treatment and prevention. So happy to hear this question and to know that we are all thinking about what it looks like to work with behavioral health and the many providers that we might be working with.
It's important too to talk about the indigenous language. We will be integrating indigenous language in some of our products and activities because we know that a big part of our communities talk are indigenous and talk indigenous language.
I see that we have a question regarding how we plan to engage families and people with lived experience, and that is part of our work, the work that we will be doing and we are doing. And as part of our outreach and engagement component, we will include members of the community, specifically those with lived experience, as part of our efforts to work community informed approaches to behavioral health services. So we will be working hand in hand with communities and individuals with lived experiences.
Yeah, and if I just may add to that, we've already in a way started partnerships actually with the Peer Recovery Center of Excellence and the National Coordinating Office, Addiction Technology Transfer Center here in Puerto Rico. We started the Latina Collaborative, working with the peer community, peer recovery community in Puerto Rico, to understand not only their needs, but also how to produce anti-stigma campaign and peer certification. So those are components that we'll be working on strongly, and thank you for bringing that point.
I would like to share also that during this cycle, we will be more focused on see the organizations in the community. And this permits us to be more grounded because we have a lot of the organizations in the communities that have different levels of expertise or different levels of service. And part of our work when we develop the language access inventory is identify that organizations and the providers or services inside of them to have the opportunity to give the community information about the settings that they have available to receive services and probably in Spanish language or indigenous language.
And if I may add to that, because I see there's a question that says, how does this center differ from the National Hispanic and Latino MHCTC? Well, from some of the things that we have discussing, the center is a bit more comprehensive in terms of the reach. So the MHCTC was more focused on training and technical assistance. Now you see that we have added components that include outreach and engagement, the inclusion of community-based organizations that we have included in the past, but we'll be working more hand in hand with them. As well as what Dr. Carrion was mentioning, the language access inventory, environmental scans, to really get a feel of the needs of our communities, to be able to provide services that are really what our communities need, are aligned with the needs.
I see that there is a workforce question about our engagement with counties and state officers, and I want to share with you that the way that we want to work with those officials is for the development of partnerships with those officials of different counties and states in order to advance the implementation of public policy that is important in the behavioral health field for our community. So those issues that have become public policy issue in the behavioral health field for our community, that we can address the lack of access to services and workforce issues. We're going to be working with that, so that becomes part of our promotion of new public policy for our communities in the workforce field.
Thank you, Dennis. If I might add to that, just to mention and take the opportunity, stay tuned for emails and email blasts, because we'll have a mentorship panel. I don't know if it was mentioned at the end of the month, and we really see mentorship for Hispanic and Latina providers as part of this workforce development and retention. We know there are cultural nuances. There are dimensions to mentorship that may be specific to navigating the complexity of mental health settings and to retaining those students of color and those Hispanic and Latina students, right, as part of leadership opportunities for them through those relational components, which are from mentor to mentee. So we'll be sharing that the 31st. We'll have a great panel discussion around that. So hopefully you can join us.
Some person asked about have a copy of our presentation. Yes, we will sending a copy of the presentation for everyone that would like to have. Another Rosa talk about the college student and the difficulty to receive grants or financial to enter the college or a university. And this is one of the issues that we will be working not from the perspective of money, however, from the perspective of how the mentoring can help our population to have more opportunities in the field. Also with the student, support them in terms of experience working with our community. However, I know that in the different states that in the federal government have grants to support the studies of students. And it will be important to go to the counselors in their schools to take more information about that.
I also want to take the opportunity, Rick mentioned our mentorship panel that will be taking place on the 31st. And this is part of our efforts in terms of workforce development. And also, we will be having a webinar next week on the 25th. We have partnered with the View Hispanic Research Center, and we want to share information regarding the diversity and heterogeneity of Latina populations. So for those of you who are interested, you may access our webpage or social media platforms to receive information on registration for these events. I know some of you have asked how you can learn about some of the trainings we'll be offering. This is a great way to do that. And also, you can access our webpage and as Eric mentioned, go to the TA request form and you can request trainings for your organizations or technical assistance.
In addition, you can receive a promotion for this webinar and panel that we'll be having in January. We will be sending promotion about them. In that, you can register.
And I think I'll address this question. Will you be connecting with organizations such as NAMI, National Association for Mental Illness? And we definitely try to engage and collaborate with as many organizations as we can. We also, through efforts that we've done, we also consult with subject matter experts. So you might see us at many conferences, for example, either through one of our representatives or panel of experts who might be there informing about behavioral issues or treatment issues pertaining to Hispanic and Latina communities. So definitely NAMI is one potential organization that we'll be collaborating with or being taking presentations to. At this point, we do have I'm gonna address this real quick. We do have a constant contact that we can also you can be included in. What we'll do is we will revise. We have everyone's email, right, who participating in this event. So what we'll do is we'll reach out to you again with our list of events. We'll have upcoming newsletters as well. So hopefully you can stay tuned to our upcoming events through that way. I see at this time, we would like to thank you, everyone, for participating. Unless, I don't know if any of our members wants to address any other questions. Yes.
Yes, I would like to thank everyone that has joined us today. And on the chat, we have seen a lot of familiar names, people that we've recognized. And we want to thank you and let you all know that we are here to service you. And please contact us, send us emails, and we will respond to your needs. And like my other colleagues said, we want to do the work that you need in your communities. So we look forward to continuing the work that we have already started. And again, a lot of people that we see on our chat, we've known them and we've worked with you before. We want to continue our work. So once again, thank you so much for joining us. And we really appreciate you taking your time to being with us.
Yes. Hey, Carmen, sorry, someone would like to talk. And if someone like to share some information, we are open to receive this.
Dr. Carrillo, I understand that the audience members don't have access to their microphones.
Okay.
Yeah.
Yes,
So any shared
because someone,
information
yes, because
can be through the
someone,
chat. Yeah.
yes, would like to talk. It will be important for this person that would like to talk. Please send an email to us and we can address your question or comments. And also remember that in our website, we have in the banner on the first web page, request TA, and you can send any request that you would like to receive. Thank you a lot. Thank you to Carmen and all of the team of the Hispanic Latino Behavioral Health Center of Excellence, Darius, Eric, Yvette, Dennis, Christine, Gwendolyn, Carmen, for being here working with a lot of commitment. And we are very excited because with this new cycle, we have the opportunity to do more for our communities. Thank you, Dr. Lar, for gave the welcome for this activity, and we are open to receive any question, comments, and serve our communities. Thank you. Remember, you can send an email to share information. Thank you.
Thank you, everyone.
Thank you,
Thank
everybody.
you, everyone,
you,
for who's
everyone.
here. Your interest is
Bye-bye.
important.
Was a pleasure.